Finally, I can wear white. That's the breath of fresh air most women are craving for, especially women dealing with heavy menstrual bleeding due to fibroids. On this special episode, I'll be dishing out my multiple fibroids journey, the symptoms, the diagnosis, the pre-operation preparations, as well as the laparoscopic myectomy with morcellator and endobag surgery. So stay tuned and we'll meet after the intro. Welcome back. This video is intended to help women with fibroids, those suffering from fibroids with symptoms like heavy bleeding, which leads to anemia, because that's what I was going through. Sometimes dealing with fibroids can be very challenging, trust me. I've been through that road, and I know sometimes most women are really very confused. They don't know which route to take, and they are thinking that the only way to have remedy is the open stomach surgery. However, disclaimer, in the course of the video, all the things and advice I'll be giving through the course of the video is solely on my experience and the research I've done over time, because I'm not a seasoned medical professional. So we are going to start by defining fibroids. What are fibroids? Fibroids are non-cancerous tumors in the uterus. There are different types of fibroids, namely submucosal, subserosal, as well as the intramural fibroids. In my case, I had all the different types of fibroids in my uterus. However, with all the different type of fibroids I had much more of submucosal fibroids. What are submucosal fibroids? Submucosal fibroids are the fibroids that are underneath the lining of the uterus. It can cause pain as well as heavy menstrual period, which can lead to very severe anemia. To start my story, I'll just give you a recap from my girlhood to my teenage, right up to my womanhood. By the age of 10, I was already a full-grown woman. What I mean by that is I already started having period at a very tender age of like 10 years old. It's only when I came to my womanhood then I understood that my periods have never been normal. I've always had to bleed more than usual, even at that very tender age of 10. So fast forward, when I got to the teenage, it became worse because I was very slim. I was a size 4. I always looked very anemic, very pale skin, and I was always very sick. I could be very well today, looking all nice and all plummy, and the next minute I'm down with severe fever or maybe body pains or one or two things. That's apart from having malaria, which is a regular disease in my home country. So fast forward to my early 20s, when I had my first gynecological visit. The doctor told me he can find foreign items within my uterus. He didn't say fibroids, he said he can see growth as well as ovarian cyst, and he was only insisting me getting a C-section. So for that reason, I did not even believe what he had to say. Whatever that doctor said that day, I just took all the information and threw them in the garbage. When I arrived in UAE, the heavy bleeding did not stop, it continued. But something was different, because I told you before I was size 4, but in the UAE, I started adding little weight. I grew from size 4 to 6 and 6 to 8, and I was just like, okay. Then later on, it was a slump. I went back to size 4, and I was even struggling to get back to size 6. Sickness, the on and off fevers, the on and off headaches, the on and off body weakness and fatigue did not really stop. because normally I just knew for sure that that was just me. I will never get well. I knew for sure that that was just my life. I'll always be a sick person. Until one day I walked into a fried chicken joint to get lunch. Then I passed out. When I passed out, fortunately for me, I woke up within 2 seconds. They asked me very vital information about myself and I was able to speak fluently and I answered all their questions. Then they told me, you can just go. Nothing is that serious. But I knew for sure within me that something was off. So I had to go to hospital. I went to hospital, and because at that time the health insurance I was having was not really the best, so the doctor just conducted a normal CBC, that's full blood count test for me, but could not really do an in-depth check on my blood to know if I had iron deficiency anemia or vitamin B12 deficiency anemia. He could not do that because my insurance could not carry that. So after the CBC test, it came back that I was suffering from anemia. So he was like, oh, your anemia is mild, it's not that serious, just drink a lot of water. He gave me some vitamins and he just prescribed me very small tablets for anemia. I took it, I went home, but I knew for sure that something was not really adding up. I knew for sure that I was really sick and I needed to do like a comprehensive check of what is really going on. So I kept my cool because I'm one of those people that really know how to handle myself a lot more when I'm sick. I really know what to eat, what not to eat, and I do a lot of research about my health. I was suspecting that I was anemic, so normally I would be much more on fruits, try to take things that will rejuvenate and give much more blood in my system. Fast forward to when I got a very good job with this very big company. So I got the job, I signed the offer, and I started work. And weeks after starting work, I went out for lunch. I met up with the talent acquisitor. She was the one who interviewed me first. She looked at me from head to toe and told me, Tato, you don't look okay to me. This is not the Tato I interviewed on the first day you came here, because it was like a 4-phase interview. She was the first interviewer that interviewed me, and she moved me from the first to the second, the third to the fourth interview. She looked at me and said, you are not okay. Something is off. You are not the person I interviewed. And that's one thing that anemia does. You can look very nice today, very beautiful. Your skin will be shining and plumping. And the next minute, just maybe after period, you look so dull, your skin is so pale, and you look very ugly. So that's one thing with anemia. So I'm that person that normally it takes me a great deal to open up to someone. I was like, okay, let me just try to open up to her. I told her, I said, health-wise, I know something is off about my health. She told me, your health insurance must be out by now. Let's finish up the lunch and go up to the HR's office to get your health insurance. Got the health insurance card, went to the ATM, withdrew some money and gave me. She said, after work immediately, please don't hesitate. Go to the doctor. Go and see the doctor. You are not okay. I'm one of those people that heed to advice very well. So after work that day, I left and I went straight. I did not go home. I went straight to the hospital. Getting to the hospital that day, the upper segment of the hospital have closed for the day. It was the emergency section that was still on. I got registered at the counter like a first timer in the hospital, and I rushed over to the emergency section. Getting to the emergency section, the lady who was doing my vitals, when she checked my pulse, it was super low. She had to drop down her instruments to go and call the doctor. So when the doctor came in, the doctor asked me, are you with someone? Did you come with someone? I said, no, I came alone. He said, I'm sorry, we just have to give you a bed for you to rest because your pulse reading is very low. I was like, okay, no problem. I'm all here. I came here for hospital, so anything you tell me, I'm ready to go by it. They took my blood for further investigation. The doctor came in to meet me and told me, you are suffering from very severe anemia. Your blood is super low. Your iron level is super low. That day, my iron level was 1. He asked me only one question. He said, do you suffer from heavy bleeding during your menstrual period? And I told him yes. He said, this is just the emergency section. He told the nurse that take her health insurance, go to the registration counter and see if the health insurance has the coverage of me seeing different specialists like the gynecologist, like the internal medicine doctor. The nurse took my health insurance, went there, and it came back that my health insurance is very powerful. I can see as many specialists I want to see. They gave me appointment cards for me to come and meet the internal medicine doctor on Saturday as well as the gynecologist on Saturday. So that's when the journey of uterine fibroid actually started. Come that Saturday, as per the appointment card, my first appointment was with the internal medicine doctor. I will never forget his name, Dr. Ajaz. He worked magic on me. Trust me when I tell you this. So I met him. He asked me a bunch of questions about the various symptoms I'm facing. He runs a very comprehensive check on me, from fatty liver to thyroid to, like, the list can go on and on for the number of tests he did for me. It came back that I was suffering from iron deficiency anemia. So he pointed out to the fact that I had fibroids because he sent me for a full abdomen scan, of which from the abdomen scan, it came back that I had uterine fibroids. After that, I went to see the gynecologist, and for the first time in my life, I had to do the intravaginal scan. She said, you have multiple fibroids. I'm so sorry, but I can't really count them because it's a lot. And she said, a lot of these fibroids is underneath the lining of your uterus. How do you cope with bleeding? Because this type of fibroids definitely cause heavy bleeding. I looked at her, I just smiled. I said, that's what brought me here in the first place. After the scan, she asked me if I've ever been on birth control pills. I told her I've never been on birth control pills. One thing she did, which was good and bad, was she placed me on Yasmin. Yasmin is a birth control pill, but for me, I was using it as a curative measure to try to stabilize my period, because at that time, I can remember very well, at that time, I will bleed from 7 to maybe 8 or 9 or even 10 days. She gave me Yasmin as a curative measure to help control the bleeding. Over time, I came to understand that this medication was just like shooting me at the foot, because for a very short period, it helped control the period. But after a while, my period became very much uncontrollable. After the whole diagnosis of me having iron deficiency anemia and me having multiple fibroids, the internal medicine doctor, Dr. Ajaz, he placed me on Feblex. It's an iron medication which is very good. It's an oral solution. It comes in very tiny shots. I have to take 2 shots of Feblex daily for 3 months. Apart from that, I was given ferritin injections where I had to go to the hospital every other day to get the medications administered intravenously. After the first treatment of Dr. Ajaz, I became me. Everything about me became so shiny. I looked so nice. I looked so healthy. And for the first time in my life, after many years, I was looking super nice. Like everything about me just came into place. I was really very happy about it. One thing Dr. Ajaz made me to understand was anemia is just a symptom of what you're going through. Let's try to fix the problem rather than trying to fix the symptoms. So he told me we have to find a way to remove those fibroids so you don't have to take this medication intravenously and the shots for the rest of your life. I was working with the gynecologist to try to see how to make things happen the best way possible for me to have a surgery. She told me she's not going to do an open stomach surgery for me. She's only going to do laparoscopic surgery. So I was like, okay, it's fine and good, it's healthy. And so I asked her about the whole procedure, and she told me the whole procedure, and she said, because I've not had a baby, so that procedure is definitely going to be the best for me to do. I concurred to it, but at the time when I had to carry on the surgery with her, she resigned from the hospital and she went to a different hospital. And unfortunately for me, the hospital she went to, my health insurance was not covered in that hospital. I met up with a different doctor in that same hospital.
So, Day 1 post-operative, how do you feel after removing the 15 fibroids? Now what you see here is a mixture of, you see this